Now I want to talk about something that is a very uh, underground basics, okay, in orthopedics, and this is you trying to give reasons why or how infections are able to cause what tissue death. Okay, necrosis is tissue death. So you have an infection there, and over time, the cells around that place are dying off. If it is muscles, they are becoming fibrotic. If it is bones, they are also becoming, weak. You understand? So this is basically okay. They said that bone infections can actually lead to necrosis because the infection is now disrupting the blood supply. Do you understand? So is the blood supply. So if the blood supply is scattered or disrupted, blood transports what? Oxygen, transport nutrients. You get. So if that particular part of the body is not getting oxygen, it's not getting nutrients, they die off. So what's the pathophysiology? How does it actually happen? First of all, there has to be an infection. So the bacteria invades. Okay, so it moves from the site of what? Infection into the bloodstream. Okay, so they're always talking about bone here because we got to this topic from orthopedics, right? Then there's inflammatory response. So your immune system is trying to what? Man up and fight the infection, right? So neutrophils and immune cells, they flood the area. They release a lot of enzymes, free radicals. Those substances, they damage the infection microorganism, but they also damage your body. Do you understand? So they damage bone, they damage the surrounding vasculature and all of that. So vascular compromise now. So the infection will now start causing swelling, pus formation, blockage in small vessels. Okay. So now the blood supply is getting cut little by little. Okay. So ischemia now. So once the blood supply is not adequate, the bone tissue is now starved of the oxygen and nutrients I was talking about. Okay, so it's not only bone tissue, it could be muscles too. Okay, I'm talking about bone here because it's orthopedics, but if you are watching this from a general aspect, you can just say anywhere you see bone, just say tissue, which could mean ligaments, tendons, muscles, bones. All right. So now there's necrosis. So dead fragments usually called what the sequestral, that's for bone. Then later on now the body's trying to make new bone. So you see like a lining of new bone around the dead bone. That's not what is known as what? Involucrum. That's for bone. Okay. So clinical consequences. If you see tissues dying, it doesn't occur all of a sudden. It shows you that what? The issue has been there for a very long time. So the patient must have had what? Persistent pain and swelling. You can see sinus tract formation, that's pus drainage to the skin, pathological fractures, and most of the times there could be systemic spread of infection.